The pandemic has certainly taken its toll on our mental health, especially for nurses who have had to face circumstances they never imagined. I am joined by Kimberly Sandor. She is the executive director of the Connecticut Nurses Association, and nurse Megan McGuire, a mental health leader at the Nurses Association. Thank you both for being here.
Thanks for having us.
Megan, I want to start with you. There were such high numbers in the beginning and just the adrenaline of taking care of people. We're at a different phase now where it's time to process. Is there a lot of burnout? What are you seeing?
Certainly. Even before the pandemic, we were concerned about burnout in nurses and really the mental wellness of nurses. And now that the added stressors of the rush to meet the needs of the pandemic are starting to subside, this is going to be a really critical moment to start to process what nurses have seen and experienced. So really important.
Yeah. And
right.
Kim, I know we say you have to feel it to heal it. What type of initiatives are you going to have to help the nurses?
We are approaching mental health and wellness, well-being from a couple different angles, realizing that everyone really processes stress in their own, kind of a way. So we have some tools, we have some apps, we have something called Take 5, which actually Hayden put out, which is a guided imagery type of app that people can go on and do. We have some coping strategies. We are doing they're free wellness webinars. We just did one on resiliency. We did one on aromatherapy. We have some coming up on how to use your voice, just some things that nurses can engage in to do a little bit of self-care. Yes. And then we're really moving into a space as well where nurses can join different support groups. So we have something called Nurses Together with the American Nurses Association and the Emergency Nurses Association, where a nurse can join a support group and talk to other nurses and just kind of, talk about what they've been through and how they're feeling and things that are going on. And we're working on a really cool initiative called Healthcare Providers First that Megan can talk a little bit more about.
Megan, we have about 20 seconds left, but let me ask you this. What do you want to encourage nurses who might be listening to this? They need help too, right?
Yeah, absolutely. Reach out, seek help. You deserve support. We're here with you. Peer support is a great mechanism. Talk to other nurses and talk to community members. And if you are a community member, reach out to nurses that you know. 1 in 56 people in Connecticut is a nurse. You know a nurse. Help a nurse.
That's right.
Right. Yeah. And they're always taking care of us.
Be sure to share the ctnurses.org website. Have them email us, call us. We can help them navigate any of these resources. We're here to help.
All right. Thank you both for being here. We appreciate it.
Thanks for having us.